What lab tests should be done at baseline and throughout patients receiving immunotherapy? It's important for us to get a good baseline assessment of patients, as some of these side effects may present as lab abnormalities as opposed to clinical changes. So baseline testing should include a CBC and differential, a comprehensive metabolic panel. It's also important to have an amylase and lipase done at baseline, as immune-related pancreatitis can occur. And you may have an early indication of that based on lab results before the patient is symptomatic. Endocrinopathies can occur, so it's important to obtain a baseline thyroid function panel. Typically, that would be a TSH, a T3, and a free T4. ACTH and morning cortisol are also appropriate. If you don't have that baseline, then you're never going to be able to have a benchmark for what changes have occurred since the immunotherapy was started. And I think endocrinopathies are one of the most challenging ones to assess and manage. And in particular, immunotherapy can cause hyperthyroidism because we have inflamed or caused immune-related thyroiditis. So you have initial hyperthyroidism. Again, it can be asymptomatic or it can be symptomatic, followed by hypothyroidism. So you basically have inflamed the thyroid and then burned it out. And so you result in hypothyroidism for the patient. One of the most challenging things is to try to sort out fatigue. And fatigue can have a variety of etiologies, not only disease-related, but therapy-related. Is it primary hypothyroidism, primary adrenal insufficiency, or hypopituitarism? So there are a variety of potential etiologies for that fatigue. So again, having a good baseline. On-treatment monitoring would include a CBC and differential and the comprehensive metabolic panel every 3 to 4 weeks, depending on what immunotherapy and the frequency of administration of the immunotherapy. Thyroid function studies should be done every 4 to 6 weeks typically. On occasions, it will be every 6 to 8 weeks, and there's some flexibility based on the patient's treatment schedule. ACTH and morning cortisol should be done approximately every 3 weeks, according to the NCCN guidelines. So there are a variety of guidelines out there now that are making it so much easier for us to monitor and manage patients. The CITSE, there's ASCO, NCCN. Again, there are a variety of guidelines that it's important for clinicians to be aware of those, as those are evidence-based from the individuals and the clinicians that have been dealing with immunotherapy for a number of years. So they will be very beneficial to those of us that are having more, that are on the learning curve, because those ahead of us have learned and set up principles. The amylase and lipase can be done as clinically indicated, although there will be times where you may pick up early immune-related pancreatitis based on lab abnormalities. Otherwise, it's most important to include those in lab testing done if a patient presents with GI symptoms, abdominal pain, nausea, cramping, dietary changes such as anorexia. So hopefully this will be helpful in giving you some guidelines on lab testing for our patients that are on immunotherapy.